Good afternoon, everyone, or good morning, wherever you're joining in. I'm Rose Gerber. I'm COA's Director of Patient Advocacy and Education, and I'm so glad that you're with us today. And for those of you that are first-time visitors or listeners, you're going to get some really great information. And for those of you that keep coming back and we see who you are, we're very grateful that you're spending 30 minutes of your day with us. Today we have a very special guest speaker, and you can see who she is by the slide right in front of you. And the title of today's talk is Paving the Path for a World Without Colorectal Cancer. And what I learned really quick, and it might be so obvious to some of you, but I don't like to assume anything, is colo is for colon cancer and rectal is for rectal cancer, and the combined word. That's where the word comes from. But what I usually do in the first few minutes of our chat is give you some updates on highlights within our organization and maybe a few comments from our previous talks. So for those of you that joined us last month, our special guest was the CEO and founder of the Prevent Cancer Foundation, Bo Eldejay. And many of you in the oncology space or the advocacy space know her and have known her for a long time. She's done a terrific job with her organization. And the name of the organization gives it away in many ways, is that a big focal point for them is screening. And I just want to remind anyone just to make sure we mute. So I'm hearing a little bit of background noise. Hopefully you all aren't out there hearing it as well. But screening is really critical for all cancer types. And one of the things I've talked a lot about is with different advocacy organizations, I'm always looking for what we have in common, and screening is a cause that we all care about. And with COA, something that we are very honored about and we take very seriously in terms of our responsibility. We know that many advocacy groups and many individuals, whether clinical or just people interested in advocacy, they do look to our leadership for our opinion and our voice and stance on various topics. And what happened last year with COVID, and it makes perfect sense, is there was a dramatic decrease in screening, in all types of cancer screening. And again, it made sense why. We were all very scared. I mean, I was scared to go to see my doctor, and I didn't start to calm down until I realized how much our cancer centers were doing to follow the CDC guidelines, and CDC being the Center for Disease Control. So not only are our cancer centers doing everything to protect cancer patients, we as an organization wanted to make sure that all of you understood that many other medical facilities, particularly those that are doing screening, they're also following those same guidelines. So I'm very excited to share that next month's guests are going to be talking to you, and we're doing something a little bit different next month too. We have 2 guests instead of 1, and they're going to be talking to you about a campaign that we are doing in partnership with Cancer Care, and many of you know that organization as well. So it's lots of great news. So that ties in perfectly to our very special guest today, Cindy Borassi, who is the president of the Colon Cancer Foundation. And to keep things fresh for you, and I'm going to point this out because you might not realize it, this is the very first time that we have had a speaker for a disease-specific cause, because for those of you who know COA, we are an organization that represents all cancer centers, independently owned cancer centers across the United States, and they treat all types of cancers. So it is our first time to have a disease-specific topic. And I'm really excited, Cindy, too. I want to welcome you. I've had the privilege of meeting many of my previous guests in person, but you and I have yet to meet in person. So it's great to see you on camera. And honestly, I'm going to be like that little teacher's pet in the front row because I really want to learn a lot today. I don't know a lot about colorectal cancer. I've met some amazing colorectal survivors over the years, but I'm really excited to really be your student today. And I know you have a lot of eager students, and I like to use that terminology a lot because really our speakers are experts in this area and we are here to learn. So Cindy, welcome, and thank you for being our special guest today.
Thanks for having me, Rose. I really appreciate the opportunity to share with you and to share with all of your listeners. I welcome the opportunity to share our knowledge with you. So I guess with that, we could go to my first slide. Well, the Colon Cancer Foundation was actually started about, well, just under 20 years ago. And our mission is essentially to get to the point where we have a world without colorectal cancer. And we've essentially, with that mission, stayed on the prevention side of the colon cancer space. As you and I have discussed, there are many organizations in the colon cancer world, as there are in the breast cancer space and the lung cancer space. And what we tend not to do is to get into the direct patient care side of things. So we like to hope that we can prevent down the line someone from ever hearing the words, "You have colon cancer." So that's what we're really working towards each and every day. Next slide, please. So our mission in a nutshell consists of three main topic areas. And we have always, well, let me back up for just a second. We were founded many years ago, as I said, I guess it's about 19 years ago now, by a colorectal cancer surgeon, Dr. Thomas K. Weber. He worked out of Montefiore in New York City at the time. And he was just honestly seeing way too many patients come in with very late stage colon cancer. And he was very frustrated with that. So he actually started one of the nation's first walks and runs focused on raising awareness and money for research to go towards understanding the disease. And the first grants that where the foundation actually gave out were to support young investigators who were trying to understand what was going on with the disease, but primarily understanding the genetic hereditary syndromes like Lynch or polyposis. And we to that day still honor that. He actually passed away 2 years ago to a very aggressive form of lymphoma. We continue that in his honor. And we also still give out a lot of grants and in the space, and I'll talk about this later on in my talk, but now focused on what's called early onset colorectal cancer, which is colon cancer that's affecting younger and younger Americans. And we'll get into that a little bit later. The second prong of our mission is advocacy. And by advocacy, we're really not talking about lobbying on the Hill, which is what many people think is advocacy. But by advocacy, we mean really focused on advocating for patients' rights to quality of life, fertility preserving care, no matter where someone is treated here in the United States, whether it's the largest academic institutions like Memorial Sloan Kettering or MD Anderson, or the smallest community healthcare setting, right? As we know, anywhere across the country, making sure that all patients have access to that care. And then also that all clinicians are being cared for. I know that sounds really interesting, but that we're taking care of our clinicians, if that makes any sense. So we as a foundation want to make sure that they're receiving top of the line education on what's going on in the space. And I'll circle back to that too. And then finally, prevention. Prevention, so for prevention for us means education and awareness. And we do that through multi-channel, omni-channel disruptive campaigns. We like to pride ourselves on campaigns that really are out of the box. And you and I have talked about some of those campaigns that we've run in the past, and we're actually just in the middle of one of those campaigns. Again, I'll circle back to that later on in our talk today, but we like to have fun with some of those more edgy campaigns. So
you certainly do. Cindy, I want to thank you for also making the comment you did about advocacy, because I know as a director of advocacy, a lot of times brand new advocates will say, Rose, I want to become an advocate, and what type of advocacy should I do? Or they think that advocacy is just one word. But as you said, there's many different types of advocacy, whether it's legislative advocacy, fundraising, peer mentoring, emotional support. And what's great about that is these cancer survivors or non-cancer survivors, caregivers, they can find the organization that works for them to fuel their talent. Like I've shared many times before, I've done every type of advocacy, but I'm petrified of fundraising. So don't ask me. I'll write a check, but if I had to fundraise, I'd be terrible at it. And then also, I really like the comment that you made about, looking out for your clinicians as well, because within COA, we are an organization that puts our priority as the patients, but we also very much care about the providers, because if we have overstressed or overworked oncologists and nurses, how are they going to be able to provide optimum care to a patient? So I really like that. And it's another form of how organizations are more aligned than we even realize. Thank you.
Yeah, in fact, last year at our summit, which, we were one of the first organizations, in the round, we all remember our summit was scheduled for April last year. And so you had that first wave that just, it was too late and they just had to cancel. There was no time to move to a virtual format.
Mhm.
We actually had the time to say, okay, I really don't know the first thing about this, but we're going to double down. We're going to say, okay, we're going to make a virtual summit happen. We had no idea how we're going to do it, but we realized that COVID had to be our focus. So we stuck with our date, which was April 21st, I'm going to say, or right around there. But taking care of our clinicians was a topic. And we actually focused on the psychosocial needs of our clinicians because of what they were having to deal with. And I mean, we had double the capacity of the summit, and that was a very well attended session. So
congratulations on that.
Yeah. So, okay, next slide. So you and I have talked about this. Our 2021 BHAG, which is Big, Hairy, Audacious Goal for the foundation, is 10,000 screenings and 1,000 patients. And by that, I mean, so COVID, we were talking about that. COVID, as you mentioned in your opening remarks, has had a devastating effect on cancer screening overall, and specifically in colorectal cancer space. It's just had an astronomical detrimental effect on screening. It's dropped significantly number-wise, and I'll get into the specifics later on. But as a foundation, we have taken it on head on, and we have dedicated ourselves funding-wise, time and effort-wise to increasing screenings in underserved and underinsured communities by at least 10,000. So all of our fundraising efforts are going into this space this year. And then also we've launched the first colorectal cancer patient registry, and our goal is to fill that with at least 1,000 patients by the end of the year. And we'll circle back to that a little bit later. Next slide, please. So as you were mentioning, we want to get into the statistics and learn a little bit today. So I'm happy to dig right into that now. Again, let's bust a few myths for people today on the call. One thing that many people don't realize is that colon cancer is the second most common cause of cancer-related death for both women and men when they're combined. And more than 50,000 people are expected to die this year of what we consider a largely preventable disease if it's caught on time. We call this the equal opportunity silent killer because oftentimes it goes undiagnosed because people don't really catch it until they're symptomatic, and then it's very difficult to treat once you get to that point. The greatest percentage increase, interestingly enough, so I alluded earlier to the statistics of colon cancer affecting younger and younger Americans. And over the last several decades, that is what's been happening. If you looked at the trends, you would see a steady decline in colon cancer incidence and mortality in those over the age of 50. And then if you transpose the same graph, you would see a steady incline in those under the age of 50. And our foundation has actually been studying this with many others in the field, trying to understand what's been going on. And while we don't know, why it's happening, we've been doing a lot to try to raise awareness of this. But what we do know, and what's really alarming to us, is the greatest percentage increase is in the youngest age group, which is 20 to 29 years old. And what was really interesting to me as I was digging into statistics for today's talk, that's the largest population in the US right now.
Wow.
Yeah, that was really interesting to me. So I'm still in a learning phase myself. So in
Those are the best educators who are still always trying to learn.
Yeah, exactly. I have papers next to my bed all the time. So what's also interesting, the recent statistics that came out by the American Cancer Society, and the lead investigator on a lot of this, her name is Becky Siegel. She speaks at our summit every year. the median age of diagnosis has now dropped from 73 years of age to 66 years of age. So what we're now seeing is, when I was saying there was a steady decline in the over the age of 50 population, we're now seeing a net slight uptick again. So there's a 1% increase in the age of 50 to 54. So we're now seeing the whole demographic shift younger. Again, we don't know why. So this is just sending alarm bells off all over the place. And again, we're not really sure why, but there's a lot of people globally studying this. And this isn't necessarily just here in the US. There are countries, and this is very interesting, westernized, Americanized countries are trending this way. So
Cindy, I also really appreciate that that you're sharing with the audience what you shared with me when we spoke, when I first invited you to be a speaker. And I, because really that's what caught my eye was the increase in the younger age of diagnoses. And you were just really honest, and you said, we don't know why. And, I think that's so critical. Like, sometimes you don't know why, and that's why there is research, and that's why you're going to share some information on some of the tools that you're going to be using so that researchers can find out why, because the facts are there. But it is a mystery, like why? And that, that's just not human desire. Well, you've told me that they're getting diagnosed earlier, but why? So I just think we're also grateful that you're honest, that sometimes you don't know the answer, and you're out there trying to seek their answer.
Yeah, of course, we're very frustrated, but again, there are teams of epidemiologists literally across the globe that come to our summit every year and stay in touch with us throughout the year. And we've even built up a digital platform for them to stay in touch year round about this, because it is critical that we get a handle on this. Mm-hmm. It has to be done. So thank you. We're excited to be a part of that, as frustrating as it is. So, one of the problems is, as we've talked, that approximately 1 in 3 adults over the age of 50 are not getting tested as they should be. And these are the guidelines as they were before 45 becoming 50. And what I mean by that is the American Cancer Society actually changed their guidelines, their recommendations, that screening should start at the age of 45 rather than 50 a few years ago. And we fully expect the USPSTF, they came out with a draft recommendation late last year, and we fully expect that to be formalized any day now. It could be this month, it could be next month. But before that even happened, we were behind in the over 50 crowd. And now we've added another 20 million Americans between the ages of 45 and 49 to get screened. And then you throw in the delay due to COVID, and we're facing a really big problem.
And just on the acronyms again, too, for anyone who might not be familiar, on that last bullet point, that's the preventive, it's this task force. So that's what that is. That's why I mentioned on the earlier slide that BHAG, when she sent over her slides, I'm like, what is this? I was so curious to explain, and she's like, it's a big, hairy, audacious goal. And I said, I'm glad I asked. Make sure you explain that one. Thanks.
All right, next slide, please. Okay, so that was a lot of bad news. I know that was some scary news, but there's some really good news in here. And this is what I really want everyone to take away from this, or part of the takeaway. The good news is we have a lot of control here. This is a largely preventable cancer. And that's the real shame in all of this. Up to 90% of these deaths don't have to happen. And everyone listening here has the control over that. And more than half of the cases could be controlled with modifiable risk factors. So we're in control of these. Smoking, diet and exercise. I hate to say it, but we all know the culprits. It's the red and the processed meats. It's, over consumption of alcohol. not getting enough exercise, excess body weight. So just upping your exercise to 30 minutes a day, a few times a week. And so we could actually make considerable progress if we were just, cognizant of this, knowledgeable of this, and taking action in our own lives. We could really make a big significant dent in the number of deaths that we see every year, just by changing these things in our lives.
Yeah, and Cindy too, you're right. Like, it's hard to look at this slide. Like, I have done my 2 colonoscopies, and I started getting them much earlier than even the recommended age due to my own cancer history. But it is hard. Like, I could definitely improve on a lot of this stuff. And but the good news is, if you look at it from a different angle, like in advocacy, advocates like to be empowered. So this is a form of advocacy too.
Right. And I like to look at this as, I try to look at this as, come at it from what can I add in that's positive, rather than what do I have to force myself to give up and change. Yes. Some people have to get to the point where, unfortunately, they have the heart attack, they have the stroke, they have the colon cancer before they're forced to make the change. But, I just like to encourage you to take a look at this, and maybe there's one of these things that you could make some small changes before it's too late. So the other good news is that we can take control of this by getting screened. And the really good news is there are multiple options out there. And I was really excited when I heard your last speaker, Bo, talk about this possible new test, which, is looking at multiple cancers. I don't know how long that is before we see it, but there are multiple options now already out there for people who, are in the 45 age group. They've hit 45 and it's time to get screened, or they already have symptoms right now and they're worried and they need to get screened. It's time for them to actually have a conversation with their doctor, but there are very safe options, especially now if you're still worried about what's going on with COVID and you're still a little anxious about seeing a provider. There's telehealth, and there are at-home tests that can be done in the privacy of your home. You don't even have to leave. There are mail options. You can actually get the results right on your phone digitally. So, plenty of options to make this a very safe procedure. All right, next slide. All right, so we just talked about bullet 1. A couple of other things I want to mention. So we talked about 45 being the new 50 and the guidelines recommending that earlier age. But one of the things that I think another thing that I don't think a lot of people know is that the guidelines already do recommend that if you have a first-degree relative, you should be starting your screening at an earlier age already. So let's talk, a first-degree relative is your mother, your sibling. So we really, as a foundation, we were kind of founded on the science and the prevention and knowing the genetic hereditary syndromes. And so it's always been very important for us, family health history. So this is another really good news moment for you. If you're listening and you're in the sound of my voice, I would really love for you to do one thing today, and that's pick up the phone. If you have relatives, siblings, mother, father, and ask if they've, had a colonoscopy and had a polyp, because that is important. That actually changes your risk, and or had colon cancer. And that impacts when you should be screened. And then for the hereditary syndromes, for example, Lynch syndrome, you could actually start screening, and that impacts the screening for your children. And we've even seen children begin screening as early as 18, 19, or 20. So again, this is critical to know your family health history for all diseases. So I'll just use that as a blanket. It's really important to know that for your entire family history. Next screen. So we've alluded to COVID-19 and its impact on colorectal cancer screening. Again, it's been devastating. At any given point, the drop in colonoscopy screening was just devastating. But back in mid-April, there was about a 90% drop in colonoscopies. And the estimates are, again, we're still getting the data, but through June, there's an estimate that there were about 18,000 or almost 19,000 missed or delayed diagnosis of colorectal cancer due to 1.7 million missed colonoscopies. So unfortunately, we're already projecting that there are going to be excess deaths due to colorectal cancer because we've missed these colonoscopies. So again, I really want to just stress that there are safe options for at-home screening to begin the process. So even if you're still anxious or there's still a delay in colonoscopy in your city or your state or your town, there are still options for screening if you're experiencing any symptoms at all. It's really critical that you contact your healthcare provider today and you try to get something scheduled. The other thing that's really happened, COVID really shined a light, as we know, on already existing disparities in health inequities and systemic flaws. We've seen that on the news pretty consistently. And so that really, it just exacerbated the problem. And that's one of the things that our foundation, as I mentioned, we've really dedicated ourselves to really trying to tackle that issue. We're in the New York State area. We're right outside of New York City. So we'll be working in those underserved communities to address screening and try to dig in very quickly to try to address that issue very quickly and right away. Next slide. So one of the things that's happened, and I think Bo addressed this on in her talk last month, but the colorectal cancer in the public health community, I think, has just come together just so well to address COVID-19. And I think one of the things that we as a colorectal cancer community have want to stress is that all of the lessons learned can be and should be applied to addressing the delays in colonoscopies and screenings, and really, taking all of these bright new ideas and applying them to this crisis. It is really what it is in the delay in cancer screenings and catching up. And so that's really what we, as a colorectal cancer community, all of the organizations in the space, including the National Colorectal Cancer Roundtable, Prevent Cancer Foundation, NCCN, COA, I think we're all on the same page that, all of these, the kind of the loosening of regulations in a smart way has to be done rapidly to make sure that we don't lose more lives, because there are safe options, right? As you mentioned,
Yeah.
where your community cancer centers can be a part of this solution, right?
And that's right. And Cindy, this is such good information. And speaking of rapidly, our time goes by so quickly. So I do know that you have some really important slides to get through. And I just want to ask our audience to stay with us for a few more minutes. And if you want to go ahead and go through, you're doing such a terrific job. And I know there's definitely some advocacy action items at the end that you want to introduce people to.
Okay, great. Thank you. So let's move to the next slide. I think we're closing in on the very end. Let's see. Okay, so I want to just stress the very last point here is, most importantly, patients need to be empowered to be their own advocate. And again, here is, if you're experiencing any symptoms at all, I really want you to feel like, get on the phone with your healthcare provider, and even feel free to contact us. You can reach us through coloncancerfoundation.org or info@coloncancerfoundation.org, and we're happy to walk you through the process of finding someone. And next slide, please. Next slide. We'll just flip fast. I want to mention a couple of the education the campaigns that we have out there. You can actually get some more information at our latest campaign. It's letsgetscreened.org. We've launched with Walgreens. It's live and up as of Friday. Next screen. And one of our edgier campaigns, which is giveacrapchallenge.com.
You did tell people you were unconventional from the beginning or disruptive. So, I mean,
okay. Next screen.
She told you up front.
I told you up front. Next screen. We'll flip through these fast.
Yes.
And finally, we'll end here. So I mentioned one of our big, hairy, audacious goals was the colorectal cancer patient registry. And this is a big way that patients can become one of their advocates. So we don't understand why early age onset colorectal cancer is happening. And so we've actually put this registry together to figure that out. So patients can actually join the registry by going to coloncancerfoundation.org, and they will be able to pull in all of their patient health data into the registry, and it will automatically sync, and they will actually be able to become a part of the solution to understanding what's driving the problem. And I think I'll end there, Rose.
Thank you so much, Cindy. This is really great information. And again, thank you for giving people your website. They can reach out to you to learn more. And I do see some people were active on the chat, and I just want to share read something directly from my partially addressed question. At the beginning of the month, President Biden did a proclamation on National Colorectal Cancer Month. And just one sentence out of there: because of the Affordable Care Act, most health insurance plans must cover a set of preventive services with no out-of-pocket costs. This includes colorectal cancer screening in adults age 50 and older. So you'll have to do a little bit of your own homework, because part of our goal is we keep this quick, but we encourage you to become empowered and learn a little bit more. Visit us at www.communityoncology.org. And Cindy, can you give your web address one more time?
Sure, it's coloncancerfoundation.org.
Okay, and thank you again to all our listeners and viewers. And now, exciting, I told you about this at the beginning. Next month, we're going to talk even more about screening and get more insight from different perspectives. We like to bring in lots of different minds. And I'm excited to share that my colleague, Nicholas will be very formal. We call him Nick, but you can call him Nicholas Ferreros, who is our Director of Communications, will be one of our guests. And Marissa Forrest, who is actually with Komen, but works in alignment with cancer care. And they're going to give you great news on our campaign, which will be public very soon. Thank you for spending your time with us today, and enjoy the rest of your day. And I'm going to go for a walk this afternoon, because that's part of the preventive stuff that Cindy said I should do. So thank you. Great job, everyone. Thank you, Cindy. Bye-bye.